I'm Greg Chadwick, and I'm honored to have assumed the presidency of the FDI World Dental Federation in Sydney, Australia at the 2023 Annual World Dental Congress. I'm humbled and honored to accept these responsibilities, and I'm very appreciative to be following Professor Hassan bin Yahya, who has been an absolutely wonderful and tireless president. I'm also very privileged to serve as Dean of the ECU School of Dental Medicine in Greenville, North Carolina. One of the fortunate things about assuming the presidency of FDI is I'm able to continue to try to achieve the vision that we've had for a number of years, and that's a world with optimal oral health. Our mission is also very similar, and I'm pleased to be able to continue with the FDI being the leading global voice of the dental profession, working with its members to improve oral health worldwide. We have three pillars in our strategy, advocacy being the central one. And advocacy is something that we do well, but it's also the way we get our work accomplished. One of our other pillars is knowledge exchange. It used to be knowledge transfer, but knowledge transfer implies going one way, for example, from FDI just to the member. But knowledge exchange implies that conversation, the importance of the member in that equation, when we're working with our members and learning from our members. And then the third pillar is innovation, and that's a new pillar, but very appropriate at this point, because we have a number of new innovations that we're going to be working with. Now, AI, for example, being one of them. And my guess is that over the next several years, innovation will become one of the more active pillars that we have, and that would include sustainability as well. Enhancing our position as the global voice for the dental profession means supporting our members and working with our partners. It also means working with other organizations, for example, WHO, as we work with them and implement our Vision 2030, begin to try to get the language of our Vision 2030 into WHO's policies. But all of these are working toward improving oral health. You've noticed that I've said several times working with our members, and that's because our members really are our greatest asset. And we're not just saying that to be saying it. We really believe that, and the way we accomplish our work is through our members and through our partners. Another area that we'll focus on is communication, by supporting our publications, by supporting our newsletters and communicating with our members, also through our wonderful International Dental Journal and presenting scholarly articles to the world. Secondly, by promoting FDI, by all we're doing through World Oral Health Day, through our awards programs, working with our members and our partners, all to improve oral health worldwide. Well, I'm really excited to be able to help deliver the message that oral health is a part of general health. And I think as we look around the world, we're paying more and more attention to general health. And as we can bring oral health into being part of general health, that's going to be very important. And I think we just need to get the message out that if you don't have good oral health, you're not healthy. We all know that prevention works, and that brushing and flossing and the use of sealants and fluorides are important adjuncts to oral health. And it's incumbent upon us to get that word out, especially in parts of the world where it's not appreciated as much as it should be. Also, it's time to get serious about free sugars. The General Assembly today just passed a position paper on free sugars and the reduction of free sugars. It's not only going to help reduce caries, but it's also going to help reduce other non-communicable diseases, because along with alcohol and tobacco, sugar is one of those common risk factors. So we can all be talking about health and also oral health as we are improving overall health in the population. Advocating for phase down of dental amalgam is also very important. While amalgam is an important and a safe restorative material, we support the phase down and the development of substitute materials. And it's important that as we phase it down, that we don't completely eliminate it until we do have a substitute, because that would really adversely affect oral health in a lot of areas. Another area is to up our game as we're advocating for health and oral health. We need to emphasize the importance of oral and pharyngeal cancer. Oral and pharyngeal cancer is among the 10 most common cancers. It has a very high mortality rate with an estimated death rate of 300 to 700,000 people per year. And we know that varies region to region, but the surveillance data is just not available. But we need to be talking more about controlling the risk factors for oral cancer and also early detection, because with both of those, controlling the risk factors and early detection, we know we can reduce the prevalence of oral cancer in the population. So we'll look forward to working with each of you over the next several years, and I'm sure together we can create a world where oral health is a right for all.